Good day. I'm Dr. Naicker. I'm one of the registrars at the Department of Psychiatry at Steve Biko Academic Hospital, affiliated to the University of Pretoria. Today, I'll be sharing my research topic on medical students and registrars' attitudes and beliefs towards transgender individuals using the Transgender Attitudes and Beliefs Scale. So the term transgender describes a set of people whose gender identity does not conform to their sex assigned at birth. Attitudes towards the transgender community are not as well described as attitudes towards lesbian and gay people. Transgender individuals face different incidences and risk certain disease profiles, which are not often considered. Most studies on LGBT people have few transgender participants. Numerous studies have reported deficient healthcare services resulting from various factors, including discrimination, lack of specialized healthcare services, not knowing enough about the needs of transgender people, and transgender people who do not seek healthcare timeously due to previous bad experiences. Transgender people subsequently have a higher risk of developing mental health problems, with an estimated risk of 60% for depression, as well as increased suicidality, engaging in risky behaviors such as substance abuse and risky sexual behavior, which in turn presents further physical, mental, and emotional health-related difficulties and comorbidities. Few studies have investigated the attitudes and knowledge of doctors, nurses, medical students, and counselors towards transgender individuals. LGBTQ health issues are rarely covered in healthcare curricula, including South Africa and the United Kingdom. In KwaZulu-Natal, healthcare workers who had no formal sex and gender-related training avoided exploring sexual histories in transgender patients because they felt uncomfortable and inexperienced. These healthcare workers were willing to learn about this group of people to be comfortable and provide an appropriate level of care. Some studies suggest that training on LGTB or transgender needs may mitigate or alleviate some of these negative attitudes. In light of that, we aim to determine if there was a difference between the attitudes and beliefs of postgraduate registrars and undergraduate final year medical students enrolled at the University of Pretoria using the Transgender Attitudes and Beliefs Scale, as well as demographic variables which were analyzed to see if they had any correlation. So the study was a quantitative survey which included the voluntary completion of a specific demographic questionnaire and the tabs. And this was conducted at Vescopie Psychiatric Hospital and Steve Biko Academic Hospital, both situated in Gauteng. So the study population that was included were participants that were older than 18 years of age. They were able to provide informed consent. They were able to read and comprehend English and were currently enrolled in the appropriate programs. So we excluded participants who were unwilling to voluntarily participate, and we excluded incomplete or incorrectly completed questionnaires. So in total, we included 201 undergraduate student surveys and 40 postgraduate registrar surveys. It should also be noted that some registrars declined participating due to the nature of the questions that were asked on the tabs. So the tabs is a self-report questionnaire designed to evaluate attitudes and beliefs towards transgender individuals. It consists of 29 items based on 3 factors: interpersonal comfort, sex or gender beliefs, and human values. And it's rated on a 7-point Likert scale. And then the demographic questionnaire, we included appropriate demographics. In completion of the entire survey, it took 5 to 10 minutes. In terms of data analysis, continuous variables were described using means, standard deviations, medians, and interquartile ranges, as well as frequencies and proportions were used to describe the categorical variables, and results were considered significant if a p-value of less than 0.05 was obtained. Ethics approval was also obtained, and it should be noted that the questionnaires were kept anonymous and all data were stored confidentially. Results that were obtained, most of the participants were undergraduate students. They were younger than 25 years of age. They were female and heterosexual, as well as 70.1% of them being Christian. Most participants were committed to their religion. The postgraduate registrar group consisted of 40 participants, 34 of which had less than 10 years of experience as a qualified doctor, and 6 of whom had more than 10 years of experience. The postgraduate registrar group also revealed in the results that they had a higher median TAB score than the undergraduate student group, indicating more positive attitudes towards transgender individuals. In the postgraduate registrar group, the TAB scores ranged from 114 to 203, and in the undergraduate student group, it ranged from 73 to 203. The postgraduate registrar and the undergraduate student group both scored similarly for the interpersonal comfort and the human values factors. However, the undergraduate student group was found to score lower than the postgraduate registrar group in the sex and gender beliefs categories. So I've included all of the questions that were asked, and in terms of the Likert scale, the percentages that we've got, but due to time constraints of this presentation, it's difficult to go through this in detail. However, we noticed that participants were less likely to give extreme answers for questions that were more sensitive in terms of interpersonal comfort and sex or gender beliefs. Participants reported being comfortable interacting with transgender people in given scenarios, but some questions elicited more negative responses. Of participants, 21% would be uncomfortable if their boss was transgender. 19.6% would feel uncomfortable working closely with a transgender individual. 22% would be upset if someone they knew had revealed that they were used to be a different gender, and 24.5% would want to decline being housemates with a transgender individual. 18.7% of participants also found to answer neither agree nor disagree to the same question. In factor 2, the sex and gender beliefs, many more participants recorded negative responses as indicated in the diagrams. And then we looked at the demographic variables that we obtained. So it was noted that participants who were married had lower TAB scores. They had lower interpersonal factor scores, as well as lower sex and gender belief scores than their unmarried participants. Heterosexual participants also were found to score lower than non-heterosexual participants, which is suggestive that of more negative attitudes and beliefs towards the transgender community. And as indicated here, that was also statistically significant. Participants who were committed to their religion had lower scores for the interpersonal factor and also sex and gender beliefs, which was also statistically significant, which suggested more negative attitudes and beliefs towards the transgender community. And we also observed the same trend with the participants who participated more regularly in religious services. So the limitations of the study was that the study was conducted among a relatively homogeneous sample base in one location, hence the findings cannot be generalized. The postgraduate registrar group had a relatively small sample size, limiting any strong statistical inference. Our results may also be biased towards a group of people who are more aware of social norms, socially accepted attitudes, and who had to suppress their personal values when treating transgender people. It may be that their responses provided a more positive reflection than what is actually present despite the anonymity of the study. Labs scale was also used, and this may not be applicable to our diverse cultural population, given that it was validated with a Christian-based population in the United States of America. So just to summarize some of the findings and discussion, our findings agree with previous studies that show that more negative attitudes and beliefs exist among men, married individuals, heterosexuals, and those who hold strong religious beliefs and are actively involved in religious services. Most of the participants in the study were undergraduate students, making it difficult to compare the outcomes in terms of statistical significance in terms of curricula. Despite this, the undergraduate group scored lower than the postgraduate registrar group, especially in the gender and sex beliefs category. All the participants had similar scores for interpersonal comfort and human values, indicating a more positive attitude towards transgender people in these categories. In this study, participants in the postgraduate group were also older and more experienced, which may have contributed to more positive attitudes towards LGBT and transgender people in keeping with previous findings. It is likely that with more experience and education, that participants in the undergraduate student group would reach the same level of acceptance as participants in the postgraduate registrar group. Previous studies, one for instance in India, found that older medical students and interns who knew more about homosexuality was associated with more positive attitudes. In Cape Town, fifth-year medical students had limited knowledge about LGBTI health because this was not adequately addressed in their curricula, which affected their professional interactions. And we would require further studies to delve into this. Aside from course registration, we also noted that being a man, being married, and being more involved in religious activities was associated with lower scores. These studies are important so that interventions can eliminate discriminatory behaviors and negative interactions towards transgender individuals are implemented, especially among healthcare workers, so that quality and effective healthcare services can be provided. So I've included some of my references there. And should there be any questions or further discussions, you're welcome to pop me an email on this email address. Thank you so much.